Hi, I'm at the Anticoagulation Forum's National Conference. It's a meeting of about 8 to 900 medical professionals that manage people that are on anticoagulation therapy or help them take their blood thinners properly and better. One of the things that I wanted to talk about a little bit is nuisance bleeding and what is it and why should we care about it. It's a term that comes up here at the meeting and I wanted to provide a little better definition around it. There are basically two types of bleeding. There is the serious bleeding, which is defined as life-threatening at times, serious bleeding in a major organ such as the heart or brain or digestive system. And it's bleeding sometimes that requires transfusion because people have lost so much blood. So that's one type of bleeding. We hear a lot about that. But then we hear about nuisance bleeding, and that's the type of bleeding that occurs from minor cuts that can be difficult to stop, bleeding that lasts more than a minute or two because people don't have the natural ability to clot blood either because of a genetic condition or because they're taking anticoagulation therapy or blood thinners. And that gets a lot of discussion here at the meeting. It doesn't sound as serious as the life-threatening bleeding, but the reality is it's this nuisance bleeding that gets in the way of people doing things, and it gets in the way of them wanting to stay on their blood thinner or anticoagulation therapy. People get tired of making themselves shaving, cutting themselves while they're doing work in the kitchen, and just say, hey, that's enough with this drug. I'm tired of this nuisance bleeding. I mean, I say that word, but get tired of this bleeding when I cut myself and I can't stop it, and I stopped taking the drug. And we've heard time and again at this meeting about how important it is for people to stay on their blood thinners to prevent stroke, prevent a heart attack the first time or an additional heart attack if they've had one already. And if we can give that people better tools to help manage that nuisance bleeding and help them understand what nuisance bleeding is, how they may be able to avoid it, and the importance of staying on their medication that was prescribed to them, everybody will end up winning, and the patients will be able to do some of the things that they love and get back to doing those types of things and not have nuisance bleeding stand in the way. So feel free to visit nuisancebleeding.com to get more information on nuisance bleeding or reach out to us directly. Thanks a lot.